Imagine a situation where every medical intervention has been tried, yet a patient's condition continues to worsen, or perhaps treatment only prolongs suffering without offering any true hope of recovery. How do healthcare professionals navigate these incredibly difficult waters, determining when to continue and when to stop? Medical futility is ethically defined as an intervention that cannot achieve its intended physiological goal or provide a meaningful benefit to the patient. It refers to situations where medical treatment would not realistically improve a patient's condition or prognosis, essentially offering no genuine chance of a positive outcome. The ethical foundation of medical futility rests on principles such as beneficence, which is the duty to do good, and non-maleficence, the duty to avoid harm. Providing treatments that are medically useless or even burdensome can violate these principles by prolonging suffering, consuming scarce resources, and offering false hope. Clinicians assess the physiological likelihood of an intervention working, while also considering the patient's values and what constitutes a meaningful outcome for them. This balance is crucial because what one person considers a benefit, another might not, particularly concerning quality of life. Applying the concept of futility in practice requires thoughtful communication and a structured approach. It involves a thorough medical assessment by the healthcare team, open and honest discussions with the patient or their surrogate decision-makers, and often the involvement of an ethics committee. The goal is to reach a shared understanding and a consensus about appropriate care, focusing on comfort and dignity when curative treatments are no longer effective. Distinguishing between quantitative and qualitative futility is important in these discussions. Quantitative futility refers to an intervention with an extremely low probability of success, often cited as less than 1% based on empirical evidence. Qualitative futility, on the other hand, means that although the treatment might achieve a physiological effect, it would not lead to any meaningful improvement in the patient's quality of life or functional status from their perspective. Clinicians also have a professional integrity to uphold, avoiding interventions that are medically inappropriate. Ultimately, understanding the ethical definition of medical futility helps ensure that medical care remains aligned with both the art and science of medicine. It guides healthcare teams in making compassionate, evidence-based decisions that prioritize the patient's best interests, avoid unnecessary interventions, and uphold human dignity during life's most challenging moments.